Hello and welcome. I'm Ramesh Ramachandran. It's good to have you again with us. You're watching a special broadcast here on DD India. We're calling it Tracking COVID-19. As you're aware, much of India and the world are in a lockdown. It's heartening to see that you are staying at home in your interest and that of your loved ones. Over the next 30 minutes, we'll get you all the news from India and around the world so that you know what it takes to be on top of the news. Remember, DD India is your one-stop destination for all the news, views and analyses related to COVID-19. As always, we take particular care to give you, the viewer, pure, unvarnished news so that you have accurate and up-to-date information. All right, let's get started. Let's begin our first segment called India in Ground Zero. If you are living in New Delhi, then the following news should interest you. Delhi's Lieutenant Governor Anil Baijal says shops selling essential commodities will remain open round the clock.
दिन में बहुत भीड़ ना हो सप्लाई की दुकानों पे, एसेंशियल सर्विसेज की दुकानों पर हम 24/7 एसेंशियल सर्विसेज की दुकानों को खोलने की इत्तला देते हैं और जो खोलना चाहे वो कर सकता है। आवश्यक नहीं है, लेकिन जो भी चाहे कि मैं 24/7 दुकान खोलूँगा जिससे कि दिन में बहुत भीड़ ना हो और शाम को भी लोग आ सकें और आसानी से सामान ले सकें।
Meanwhile, Chief Minister Arvind Kejriwal in turn says essential service providers are being given e-passes.
हम लोगों ने ऐसे लोगों को जो आपको सर्विसेज प्रोवाइड करते हैं, रेडी वाले जो सब्जी लेके आते हैं, किराने की दुकान वाले, आपकी दवाई की दुकान वाले, आपकी दवाई बनाने की फैक्ट्री वाले, उनके कर्मचारी, इन सब लोगों को हमने पास देना, ई पास देना चालू किया कि आपको हमारे पास आने की जरूरत नहीं है। आप 1031 नंबर पे, मैं दोबारा रिपीट कर दूं, 1031 नंबर पे आप अप्लाई कीजिए, आप फ़ोन कीजिए, वहाँ पे आपको बता देंगे कि किस नंबर पे व्हाट्सएप करना है और आपको व्हाट्सएप के ऊपर ही आपका पास आ जाएगा।
Right, moving on, India has asked its provincial governments to deploy additional medical facilities and fiscal resources for fighting COVID-19. Let's take a look at the latest data regarding the spread of coronavirus in India today. The total number of active cases of COVID-19 in India has risen to 593. 13 deaths have been reported in the country. 42 people have been discharged from hospitals. The highest number of cases have been reported from Maharashtra and Kerala. 124 positive cases in Maharashtra and 109 cases in Kerala. Right, in Kerala, 109 confirmed cases include 8 foreign nationals. Now, 4 persons have been cured and discharged. No death has been reported from the state till now. Besides Maharashtra, Kerala is the only state where the number of confirmed cases has crossed the 100 mark. And our Kerala correspondent sent us this report. Take a look.
Now I am standing in MG Road, Ernakulam, one of the hectic street in the city. Usually we can see a very long queue of vehicles here. The city is completely free now. Police giving passes for emergency and police seizing vehicles coming out to streets unnecessarily, not for fulfilling basic needs, and vehicles will be released after April 14th only. Shopping malls, small shops, everything is closed. All public transportation including KSRTC, Kochi Metro are closed. All events are cancelled. Instructions of central and state governments will help to prevent the mass spread of COVID-19. Hope the complete lockdown will help Kerala state to overcome the situation soon. I am Sam Kadaminata from Ernakulam, Kerala for DD News.
And shifting focus to Maharashtra now, where 124 confirmed cases of COVID-19 include 3 foreign nationals. 1 person has been cured and discharged. 3 have died. 48 confirmed cases have been reported from Mumbai alone. Maharashtra remains the worst hit state in the country. The Maharashtra government has warned people that if they are seen roaming without a valid reason, they will immediately be imprisoned. It has sealed district borders, resulting in a long queue of trucks and tempos at the border of every district as well as the state border. Meanwhile, people in Madhya Pradesh's Bhopal came out to buy essential items amid the lockdown. Shopkeepers marked circles in which people have to stand in order to maintain social distancing. Right, so these are the visuals from Bhopal in Madhya Pradesh, where you can see people standing in circles marked for every person standing in the market in the interest of social distancing and avoid the spread of the contagion called coronavirus. So these are visuals from Bhopal in Madhya Pradesh. In other news, India's premier institution, the All India Institute of Medical Sciences, popularly known as AIIMS, will soon begin a teleconsultation facility for patients. Why? Because AIIMS has temporarily suspended routine walk-in OPD registrations from 23rd March as part of an effort to redirect its resources to control the COVID-19 outbreak. Follow-up patients and chronic patients can consult doctors through this facility. Right, so as I mentioned before, teleconsultation will be soon available to patients at the All India Institute of Medical Sciences, also known as AIIMS, in New Delhi. This is to avoid the spread of coronavirus and discourage patients from flocking into the hospital and to avoid social distancing at the same time. Right, now to some international news. President Vladimir Putin of Russia has announced a week-long nationwide holiday in an effort to stop the spread of COVID-19. Putin stopped short of calling for a lockdown, but says it is safest for people to stay at home. Julia Chapman reports in Moscow. Take a listen.
Next week, everybody in Russia, unless they work for essential services, will be given a full week of unpaid leave on the government's dime. That was an announcement made by President Vladimir Putin when he gave his first address to the nation since the coronavirus outbreak began. He said that he hopes people will stay at home, although he stopped short of mandating that they do so, like we've seen in other countries where they've introduced full lockdowns. But President Putin hopes that by giving everybody the week off, they will not use public transport, they won't be exposing each other in their workplaces. Alongside that, he also announced that a referendum on constitutional amendments that was scheduled to take place in mid-April, that will be pushed back indefinitely and won't be rescheduled until health officials say it is safe to do so. That referendum includes an amendment that could see Vladimir Putin remain in power in Russia until the year 2036. President Putin also announced a number of measures aimed at protecting both businesses and individuals from the economic effects of the coronavirus outbreak. He announced that for those who need it, who see a big drop in their income, they will be able to apply for rent breaks, rent holidays, as well as loan payment deferrals. And the system of welfare in the country will automatically be renewed for 6 months, stopping people from having to go into offices or make contact with other people.
So that was Julia Chapman in Moscow reporting for DD India. Let's shift our focus to East Asia now. South Korea has been praised globally for its success in the fight against COVID-19. Many countries have reached out to South Korea for advice and equipment in their own battles. As Bruce Harrison reports from Seoul, the US is the latest country seeking help from the South Koreans.
South Korean President Moon Jae-in visited a company here that produced the coronavirus test kits, and it was there he confirmed that President Trump has asked for test kits and other quarantine-related products from South Korea to help the United States in its fight against a growing number of coronavirus cases. Presidents Moon and Trump had spoken on the phone, and according to Moon's office, Trump had asked for medical equipment, and President Moon had responded that South Korea would do its best to help the United States and would be able to send supplies based on the supply here and domestic demand at home. According to Moon's office, President Trump also praised South Korea for its efforts in the fight against COVID-19. Now, in the months before the outbreak globally, President Trump wasn't too complimentary of South Korea. He's referred to the country many times as a freeloader over what it pays to share the cost of keeping U.S. troops in South Korea. And if the two can't decide on how to split the bill by the end of this month, it could mean layoffs of thousands of Koreans employed by the U.S. military. So there's some bad blood there as well. But right now, President Trump reaching out as the coronavirus outbreak spreads rapidly in the United States. As far as South Korea goes right now, there was 100 new confirmed cases in this country on Tuesday. Still a far drop from the peak of roughly 900 cases we saw earlier this month, but there are a growing number of infections in the capital region that is raising some concerns that there's plenty of work left to be done despite Korea's success in its fight against coronavirus, and a resurgence is definitely possible in this country.
All right, time for a very short break. Keep watching DD India. Don't go anywhere.
मान्या, बच्चा पार्टी क्या कर रही है?
हम खेल रहे हैं।
तुम्हें डॉल्स मिली हैं खेलने के लिए कुछ?
I'm worried about bullying, discrimination, and stigmatization. What is the best way to talk about COVID-19? Here's what you can do. Do not attach location or ethnicity to the disease. Remember, viruses can't target people from specific populations, ethnicities, or racial backgrounds. Do not refer to people with the disease as COVID-19 cases or victims. Refer to them as people. Do not talk about people transmitting COVID-19, infecting others, or spreading the virus, as it implies intentional transmission and assigns blame. Do not repeat or share unconfirmed rumors, and avoid using hyperbolic language designed to generate fear like plague or apocalypse.
इस वैश्विक महामारी से मुकाबला करने के लिए देश की स्वास्थ्य सुविधाओं को तैयार करने का काम केंद्र सरकार लगातार कर रही है। विश्व स्वास्थ्य संगठन, भारत के बड़े चिकित्सा और अनुसंधान संस्थानों तथा स्वास्थ्य
hand hygiene practice each time you go and wash your hands, and soap and water is the best.
You have traveled to outside for 14 days to the affected countries, or you have been in contact with a patient of COVID-19 proven case, then only you may require test, otherwise you don't have to.
Welcome back. Now to a segment called Doctors Speak. Dr. Randeep Guleria, the director of All India Institute of Medical Sciences, talks about how to keep yourself mentally and physically fit in home quarantine. Take a listen.
घर के अंदर एक एरिया बना लें जहाँ पे आप घूम के वॉक कर सकते हो। दूसरा इम्पॉर्टेंट इशू इज मेंटल हेल्थ। इसमें ये बहुत ज़रूरी है कि हम लोगों से सोशलाइज करें, घर के और जो परिवार के लोग हैं उनके साथ इकट्ठे बैठ के बात करें। कुछ इंडोर गेम्स खेल सकते हो, कार्ड्स हैं तो कार्ड्स खेल सकते हो, इकट्ठे बैठ के कोई टीवी पे मूवी देख सकते हो। इस टाइप के कई एक्टिविटीज़ कर सकते हो जिससे आप सोशलाइज भी कर लें। ज़्यादा हुआ तो अपने दोस्तों के साथ फ़ोन पे बात कर सकते हो, चैट कर सकते हो, जिससे आप अपने आप को बिजी भी रखो, मेंटली स्ट्रांग रखो और इस 21 दिन में फिजिकली और मेंटली स्ट्रांग रहो। योगा जो है वो आप सुबह उठ के सब लोगों को योगा करना चाहिए, मेडिटेशन करना चाहिए। ये हमारे जो मन में योग कोरोना के बारे में और सोचने से जो परेशानी है वो भी कम होगी। अब हमारी ब्रीदिंग से हमारी लंग की कैपेसिटी भी बढ़ेगी और ओवरऑल पॉजिटिविटी भी शरीर में आएगी।
All right, moving on. Believe me, it is normal if you happen to experience anxiety or frustration due to disruption of your daily routine. But don't worry, here are some tips for successfully navigating through these testing times.
While India sets on the fight against COVID-19 outbreak, It is very important to take care of one's physical and mental health during home isolation. Make sure you have healthy balanced diet every day and do not forget to hydrate yourself adequately. A sound mind can only be found in a sound body. So exercise regularly at home. Union Minister for Sports and Youth Affairs, Kiran Rijiju, gives us a peek into his fitness regime during the lockdown.
To prevent coronavirus, we all are staying home but working online. मैं आप सबसे दरखास्त करना चाहूँगा कि घर में बैठे बैठे फिटनेस को ना भूलिए। ये रोप स्किपिंग बहुत ही आसान एक्सरसाइज है। हर दिन कम से कम 2-3 मिनट सबको करना चाहिए ताकि फिट इंडिया मूवमेंट को भी हम आगे बढ़ा सके और साथ साथ में आप कोरोना वायरस से भी बच सकते हैं।
Set aside time to spend with each of your children, clearing their doubts, teaching them proper hand washing and safe distancing. Ministry of Health and Family Welfare's free online comic series for children, Kids Vayu and Corona, can be used to create awareness about COVID-19 among children. It has entertaining pictures telling the story of a superhero fighting and defeating the virus. In unusual times such as these, it is normal to feel concerned. Even when you are isolated, stay connected with your loved ones through phone, messages, or online. Do things you enjoy by following a hobby or learn something new. The National Institute of Mental Health and Neurosciences at Bengaluru is offering a helpline number for pregnant and new mothers with anxiety or mental health issues. Avoid watching, reading, or listening to content that make you feel anxious or distressed. Refer to only reliable sources of information such as DD News, All India Radio, Ministry of Health website, and PIB Twitter handle. Fact-check information that you get through WhatsApp or Facebook and do not forward or share doubtful news. Arm yourself with correct information and do not believe fake messages. Be a socially responsible citizen and follow instructions issued by the government. Avoid panic buying and stockpiling of essential items as warned by the Honorable Prime Minister. While venturing out, make sure to maintain a distance of at least 1 meter from other people. Do not fall into online frauds by clicking suspicious links or revealing sensitive information about yourself over phone calls. And last but not the least, become role models to the society by being empathetic to others, avoiding stigma, and acknowledging the hard work of frontline workers. Protect yourself and others from coronavirus. Stay home, stay safe.
All right, so it's very important to keep yourself occupied, engaged, play a board game with your friends or family, if you will, or practice skipping, as Minister Rijiju did in that video. It's important to stay at home and be safe. All right, time now for the Citizen Video segment. Now, many of you have been sharing your videos with us. I want to share one that's coming from Sriram Compella. Now, Sriram is an Indian student at the Politecnico di Milano in Italy. Here's his video. Take a look.
Namaste friends, my name is Sriram Compella and I'm a PhD student from Politecnico di Milano. I'm currently in Milan in Italy. As you know from the news, nearly 70,000 cases of the novel coronavirus COVID-19 have been registered so far in Italy. The number is getting worse day by day. Luckily, India has some time to react before the situation gets further out of hand, or at least this bad. Prime Minister Modi's timely move to impose a complete lockdown is going to facilitate social distancing. By facilitating social distancing through the lockdown, we are going to ensure we don't contract the virus or we don't spread the virus right now, because that is the only way to stop the virus, because there is no other vaccine. So I urge you all to please take the lockdown seriously. This lockdown is like a preemptive surgical strike on the virus. Please follow the precautions and protocol. Please cooperate with the government. 21 days of lockdown is a very small price to pay compared to the lives of our near and dear ones like Italy is paying right now. Trust the government, cooperate with the authorities and make sure that the virus is contained as quickly as possible. Lockdown for a short period is the safest, fastest and the most effective way to ensure India returns to normalcy.
And that's a wrap on this special broadcast. I want to leave you with a poignant video of Lawrence Wong, a minister in Singapore, who tears up as he thanks healthcare workers and other Singaporeans who have contributed to the fight against the COVID-19 outbreak. Thanks for watching. Bye-bye and stay home, stay safe.
Words are not sufficient to express our appreciation for Mr. Speaker, words are not sufficient to express our appreciation for all of those who are excuse me. Please give me a minute. Let me just rephrase that, repeat what I said just now. Words are not sufficient to express our appreciation for so many Singaporeans going all out to fight the virus. But I just want to say a big thank you to everyone who's doing their part.